Watch this and we'll talk about it on the back end.
Americans get their health care in a number of ways. About half of them, a little over half of them, get it through their employer. The rest who have health care get it through the government, some through Medicaid, and others through these marketplaces. The marketplaces were created under Obamacare to allow people who don't get their health care in other ways to buy it with some help from the government. And it's been an enormous take-up of it, particularly because in 2021, in the Biden administration, these subsidies were substantially expanded to cover more people at higher at incomes that are still very modest, but up from the bottom. And so what's happened is that between 2025, you had more than a doubling of people enrolling in these marketplaces. There are now 24.2 million people enrolled in these marketplaces. Where was the biggest increase over the last 3 years? It was in red states. 157% increase in the number of people in the marketplaces versus 36% in blue states. You can see that also over here on this map, where you see that a number of red states, Texas, Utah, and so forth, all have over 10% of their people enrolled in the marketplace. Why is this so much a factor in the red states? Because Medicaid was not expanded in many of these states. States had an option back after Obamacare was passed, whether to expand Medicaid or not. The red states often didn't, so their people had less insurance, and so when this happened, they took advantage of it. And you can also see down here, if you look by Republican congressional districts across the country, almost 8% of people are in the marketplaces, whereas only 6.3% of the Democrats. So that's why Marjorie Taylor Greene is so exercised about this, is because it is heavily a red state phenomenon. Red states versus blue states. Red states use these premium tax credits almost twice as frequently as the blue states. And you can see that here. And the benefit, the average benefit in the red states is $580 a month, which is $5,700 a year is the average benefit people are getting, also higher than in the blue states. And one last point on this, if you look at the increase in uninsured that will occur based on what was passed in the One Big Beautiful Bill, both the reduction in these premium tax credits as well as the Medicaid cutbacks, you can see again that this is going to hit the red states harder. 7 out of 10 of the most affected states will be red states. And so people are waking up to this. And in fact, there was a poll, to the point Claire made it out polls, there was a poll that 78% of Americans support these tax credits, and even a majority of self-identified MAGA people support these tax credits. Now, to your point, Joe, on fact-checking, one of the things the Republicans have been saying is that a lot of undocumented or illegal immigrants are getting health care through our federal system. That is simply not true. They cannot get health care through Medicaid. They can't take advantage of these tax credits. None of that is true. All they can do is go to an emergency room, and under federal law, anyone who goes to an emergency room must be treated. The government reimburses the hospitals for that. But if you look at all of the Medicaid spending, only 0.4% is on this emergency room subsidy, which not just includes undocumented immigrants, it includes all Americans of every sort who go there. So you're talking about a trivial amount of money that perhaps an undocumented immigrant is able to take advantage of.
MAGA. Where do you get your health insurance from? Because it's all going to be affected. All of it. And I don't give a shit where you get your health insurance from, it's going to be affected. But ask yourself, where do you get your insurance from? Do you get your insurance through the Affordable Care Act, through the marketplace? Because if you do, those subsidies that you're getting help with paying your insurance, they're going to go away if the Republicans get their way. For example, I pay $967 and change every month for our insurance through the Affordable Care Act marketplace. That's after the government picks up $533 of it. So when the subsidies go away, my $967 a month bill is going to go up by $533 every month. Where do you get your insurance? Is it through the Affordable Care Act? Because if so, go look at how much the government's chipping in for your subsidy. That's going to go away if the Republicans get their way. Whatever that number is and what you're currently paying, that's going to be your new bill that you have to come up with. Are you on Medicaid? You're going to cut back on that too. Put in new work requirements, more restrictions. You're most likely not going to meet those requirements. Do you get your insurance through a private employer, like you have a job, they provide insurance through your job. On average, if the Republicans get their way and all of this goes through, on average, private insurance, employer-based insurance, is going to go up by 18%. Can you afford an 18% increase in your monthly premiums? The people who you are voting for are fucking you out of your health insurance. And you're cheering them on. Because you think brown people are getting health care. When that's not the case. You're literally being lied to by the people that you vote for so that they can sneak behind your back and take your fucking health insurance away from you. Or at least jack up the price of it to the point where you can't afford it. Ask yourself where you get your health insurance and then go down the line and see how this is going to affect your out-of-pocket expenses, MAGA.